I know that moms, we have a lot going on, but we have to be very, very observant because sometimes our observation can save our children. Cancer is something that a lot of people do not want to hear, and for very valid reasons. Nobody prays for them or their loved ones to have cancer. Unfortunately, cancer is real. It happens. And for some conditions, like the condition I'm about to talk about today, it can be cured early if you're aware of the signs early. On the grand scale, eye cancers are rare, but the most common eye cancer occurs in children and is called retinoblastoma. Retinoblastoma is a cancer of the retina. The eye has about 3 layers. It has an outer, a middle, and an inner layer. The retina is the inner layer. Okay, that is the layer that when light enters our eye, it will communicate with our brain, and our brain will change that light to vision. Retinoblastoma can occur in both boys and girls, but usually occurs in children less than 5 years of age. Now, people will ask, how can I make retinoblastoma catch my own child? For every human being, we have 2 types of genes when it comes to cancers. We have the good genes. Those are called the tumor suppressor genes. These ones help to slow down cancers. They help to stop cancers. And then we have the oncogenes, which are the bad genes. Now, once these ones are activated, they help to grow cancer. What happens in retinoblastoma is called the 2-hit hypothesis. What that means is that good gene, which are the tumor suppressor genes, are destroyed when the baby is born. There's one hit as the baby is born, and there's another hit once the baby is born. So now that we've tried to explain what retinoblastoma is, how can a parent identify the early signs of retinoblastoma? The first one is a whitish speck in the eye. We call it leukocoria. When you take a picture of a child, you should see a red glow from the child's eyes, like so. But the moment you're seeing any whitish glow, or you've noticed any whitish discoloration of your child's eyes, please take that child to the hospital as early as possible, because it may not be what you are thinking it is. Some people may think it is cataract. Some people may think it is. It's not in a parent's place to think of diagnosis. The only thing a parent or guardian should do when they notice anything strange about their child's eye is to take that child to a standard hospital so that that thing can be looked at properly. Another way retinoblastoma can present is that the child will have quarter past eye. Personally, anytime I see a child with quarter past eye, I always do a dilated exam for that child. We'll put in some eye drops and look at the back of that child's eye, because it may just be eye cancer and not just ordinary quarter past. Another way retinoblastoma can present is that the child will just have swelling of the eye. It will be as if they have a boil in their eyes. By the time the child is presenting something like this, it may just be a bit too late. Retinoblastoma progresses very, very fast. And so I know that moms, we have a lot going on, but we have to be very, very observant because sometimes our observation can save our children. If retinoblastoma is not discovered or detected early, it will end up looking something like this. Now, when it comes to the treatment of retinoblastoma, the most important thing we want to do is to save that child's life, because retinoblastoma can spread from the eyes to other parts of the body, especially the brain. But if it has not, then our goal is to save the child's eye. And if it is still early, then we want to preserve that child's vision. So that's how the order of our treatment goes, depending on the stage. Once the child presents to us, we examine the child, send the child for a scan. If the child presents really early, then we can do focal therapies. But if it has advanced, then the child will have to go through chemotherapy every 3 weeks. And if it is really, really advanced, then we'll have to remove the eye. Yes, we'll have to remove the eye completely to save that child's life. Unfortunately, in Nigeria today, all the retinoblastoma cases I have seen personally, we had to remove the child's eyes. Yes, because parents presented late. It's either they presented late due to denial, they didn't want to accept what was going on, or they didn't notice it on time, or things that could have changed the entire course of the management. Even after removal of the eyes or after chemotherapy, we have to keep following that child up. Long-term follow-ups, because we have to be sure that there's still no spread in any other part of the body. And so this video is extremely important. We have so many children with retinoblastoma across Nigeria, northern Nigeria, southern Nigeria, western Nigeria, and we can have better outcomes if we are aware of the signs early and we share this video widely and across. It may just be beneficial to someone. Thank you so much for watching, and I'll be seeing you in my next episode. Bye.